Eczema, also known as atopic dermatitis, is a chronic skin condition that affects millions of people worldwide. It is characterized by red, itchy, and inflamed skin, often appearing as patches or bumps. Eczema can be a frustrating and uncomfortable condition, but with proper treatment, it can be managed. Cause: eczema is a complex and multifactorial skin condition that involves genetic, immunological, and environmental factors. It is thought to be caused by a combination of genetic predisposition, immune dysfunction, and environmental triggers. Genetic factors: there is a strong genetic component to eczema. It is estimated that up to 80% of people with eczema have a family history of either eczema or other allergic conditions, such as asthma or hay fever. Certain genes have been identified as being associated with eczema, particularly those involved in skin barrier function and immune regulation. Skin barrier dysfunction: the skin is the body's first line of defense against environmental irritants and allergens. In people with eczema, the skin barrier may be impaired, allowing irritants and allergens to penetrate the skin and trigger an immune response. This leads to inflammation and the characteristic symptoms of eczema, such as redness, itching, and rash. Immune system dysfunction: the immune system plays a crucial role in the development of eczema. People with eczema have an overactive immune system that responds abnormally to environmental triggers, such as allergens and irritants. This results in the release of inflammatory chemicals, such as cytokines and histamines, which cause the characteristic symptoms of eczema. Environmental triggers: while eczema is primarily a genetic and immune-mediated condition, certain environmental factors can trigger or exacerbate symptoms. Common triggers include harsh soaps and detergents, wool and synthetic fabrics, dry air, and extreme temperatures. Stress, infections, and certain foods may also trigger eczema symptoms in some people. In summary, eczema is a multifactorial condition that involves genetic, immune, and environmental factors. While the exact cause of eczema is not fully understood, it is clear that a combination of genetic predisposition, skin barrier dysfunction, immune dysfunction, and environmental triggers contribute to the development and persistence of eczema. Understanding the underlying mechanisms of eczema can help to inform the development of effective treatments and strategies. For prevention. Symptoms: the symptoms can vary from mild to severe and may come and go over time. The following are some of the common symptoms of eczema. Dry skin: eczema can cause the skin to become dry, scaly, and itchy. The skin may also appear rough and thickened. Itching: itching is one of the most common symptoms of eczema. It can be intense and persistent, and scratching can cause the skin to become even more inflamed and irritated. Redness and inflammation: eczema can cause redness and inflammation in the affected area. The skin may appear swollen, and small, raised bumps may form on the skin. Cracking and bleeding: the skin in the affected area may become so dry and cracked that it bleeds. Oozing and crusting: in more severe cases of eczema, the skin may ooze and crust over, especially if it has been scratched or rubbed. Thickened, leathery skin: repeated scratching and rubbing can cause the skin to thicken and become leathery in texture. Darkened skin: eczema can cause the affected skin to become darker in color than the surrounding skin. Sensitivity: people with eczema may be more sensitive to certain substances, such as wool, synthetic fabrics, or certain soaps and detergents. Infection: eczema can make the skin more susceptible to bacterial, viral, or fungal infections, especially if it has been scratched or if the skin barrier is compromised. In summary, eczema can cause a range of symptoms, including dry, itchy, and inflamed skin, as well as redness, cracking, and bleeding. The symptoms can be persistent and uncomfortable, and in more severe cases, they can significantly impact a person's quality of life. It is important to seek treatment for eczema to manage symptoms and prevent complications. Treatment: the treatment of eczema aims to relieve symptoms, prevent flare-ups, and reduce the risk of infection. Treatment may involve a combination of self-care measures, medications, and lifestyle changes. The following are some of the common treatments for eczema. Moisturizers. Applying moisturizers regularly can help to soothe and hydrate dry skin. Look for moisturizers that are free from fragrances and other potential irritants. Topical corticosteroids. Topical corticosteroids are commonly used to reduce inflammation and relieve itching. They come in a variety of strengths, and your doctor will prescribe the appropriate strength based on the severity of your eczema. Topical calcineurin inhibitors. Topical calcineurin inhibitors are another type of medication that can reduce inflammation and relieve itching. They are particularly useful in treating eczema on sensitive areas, such as the face and neck. Antihistamines. Oral antihistamines can help to relieve itching and improve sleep, particularly if itching is interfering with your ability to rest. Wet dressings. Wet dressings can be applied to the affected area to soothe the skin and reduce inflammation. They involve applying a wet dressing to the skin, covering it with a dry dressing, and leaving it in place for several hours. Light therapy. Light therapy involves exposing the affected area to controlled amounts of natural or artificial light. It can be useful in reducing inflammation and controlling eczema symptoms. Avoiding triggers. Identifying and avoiding triggers that worsen your eczema symptoms can be an important part of treatment. Common triggers include harsh soaps and detergents, wool and synthetic fabrics, dry air, and extreme temperatures. Lifestyle changes. Making certain lifestyle changes, such as reducing stress, maintaining a healthy diet, and getting regular exercise, may also help to manage eczema symptoms. In summary, the treatment of eczema typically involves a combination of self-care measures, medications, and lifestyle changes. It is important to work with your doctor to develop a treatment plan that is tailored to your specific needs and takes into account the severity of your eczema, your triggers, and any other underlying health conditions. With appropriate treatment, most people with eczema can effectively manage their symptoms and improve their quality of life. Disclaimer: the information provided in this video is for educational and informational purposes only, and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a qualified healthcare provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have seen or heard in this video. The views and opinions expressed in this video are solely those of the individuals involved and do not necessarily represent those of any organization or institution they may be affiliated with.